This is the first of a series of informational videos sponsored by the IFord Institute. The title is The Greatest Medical Problem of the 21st Century. IFord is the Institute for Disease Prevention Engineering. The information for this video comes from the text Creating Healthy Hospitals, which is available at iford.org. IFord's efforts are directed at solving the greatest medical problem of the 21st century. That is, the loss of antibiotic effectiveness due to the creation of superbacteria such as MRSA, KPC, and many others. Today, hospitals are breeding grounds for superbacteria that are increasingly resistant to antibiotics. Soon, antibiotics will not work. IFord has the solutions to solve this problem. New, more powerful antibiotics can damage patients and are simply not healthy. More powerful antibiotics are not the answer. More than 70 years ago, Sir Alexander Fleming, the discoverer of penicillin, stated in his Nobel Prize lecture that non-therapeutic dosing of patients with antibiotics will create supergerms. We are in complete agreement with his view. Soon after Dr. Fleming's remarks, superbacteria began appearing in hospitals, and the increase in virulence has continued unabated to present. However, in hospitals, the continued reinfection and creation of deadlier genetic mutations of bacteria is not related to non-therapeutic dosing of antibiotics, but caused by improper facility design, management, and care within the healthcare system. Bacteria is expected to continue to get genetically stronger until antibiotics simply become just another historical footnote. IFord's aim is to prevent this catastrophe. Medical centers and hospitals are today operated like mom-and-pop businesses rather than like true modern technical facilities. This at face value seems to be an absurd contradiction. How can some of the greatest medical facilities be operated at a level below, say, a fast food restaurant? Stay tuned and learn. If a fast food restaurant causes a single non-fatal illness, it may become front page news. But if a hospital kills 10 people, not a cry will be heard. How big is this problem? We really don't know. The counting of death and disease within the healthcare system is a study in flagrant deniability. HADs may be the third leading cause of death in the United States. If you look at the chart, reported deaths have pegged at the largest whole number that is less than 6 digits, 99,000 victims. By keeping the death count below the 6-digit threshold, this keeps the severity of HAD deaths in the background of concern. If I had to estimate the real number of HAD deaths, it would be more like 250,000 victims. A recent case study in flagrant deniability was passed on by a contractor visiting our offices recently. He inquired about a hospital room sterilizer being assembled and asked, "Will that come MRSA?" When his family brought home their newborn son from the hospital, they had to return the next day with a case of MRSA. The comment from the attending physician was, "He did not get that here." The main reference for the IFord channel is the text Creating Healthy Hospitals and is available from iford.org in PDF format. The IFord Institute is the only organization dedicated to disease prevention engineering and promoting the healthy hospital design. The professionals in the business have failed miserably. Please become part of our effort to re-engineer the healthcare system. Thank you for visiting our channel.